I'm Kimberly Fletcher. I'm the president and founder of Moms for America. And I'm making this video because I have been receiving a lot of messages and questions and emails on my personal page, on our Moms for America pages and platforms, asking a lot of questions about what's going on and should we be concerned about this or that. And what I'm realizing is people just don't really understand what's going on. So I want to, from a mom's perspective, my own perspective, tell you what we're dealing with here. First, I want to address the media. Stop. Just stop. Stop making this all about the blame game or a political tactic to take somebody down. Listen, a week ago, I was there too. Everybody just needs to go back to work and back to school. This is ridiculous. This is overplayed. And it's because the media. People aren't taking this seriously. They're just looking at it as another thing that the media and politicians are doing to weaponize any issue that comes down the road against the president. But this is a real issue, and people are downplaying it because the media isn't doing their job. We have one common enemy. It is this virus. And we need to unite together to defeat it because we're the only ones who can. I want to talk to the politicians, not the statesmen who are doing everything that they can to try and preserve the republic and protect the general welfare. I'm talking about the politicians who are trying to make this an opportunity to destroy the republic and don't give a lick about the general welfare of the American people. And while I'm not somebody who's a party player, and most people in America aren't, in fact, we're pretty sick and disgusted with all of the parties, what really infuriates me is that a whole entire political party and the leadership of the party, the Democrat Party, is trying to use this whole entire situation as a way to cause us to have less freedom, more taxes, and push their pernicious agendas that are anti-freedom, anti-family, and just anti-American. It is despicable. It is unacceptable. And any of you moms out there who have a congressman or a senator who's a Democrat, flood their phone lines because this is ridiculous. There are people who really are trying to do the right thing, whether or not it's the right constitutional thing or not. That's a discussion for another day. But right now, the government has had to shut things down. And if the government is going to shut things down, then the government is responsible for finding ways to get it back up. And that doesn't mean opening the doors. It means helping people who are in situations where they can't get out their door. That's what members of Congress have been trying. And the Democrat Party, Nancy Pelosi specifically, flew back into Washington, D.C. to tell the Republicans or the other Democrats, strong arm everybody. It's all about these ridiculous political games, telling them that if they want their bill passed to help the American people, to help the medical infrastructure, oh my gosh, that's something that we should be doing, helping the medical infrastructure. Nancy Pelosi is saying that they're not going to help the medical structure unless they get their Green New Deal and all the other poppycock that they've been trying to push forever. There's a quote by Rahm Emanuel that's been circling through my head, and this morning it started going out all over social media again. Never let a good crisis go to waste. And when you hear those words, that means the dismantling of everything that we know and hold dear. And yeah, you should be worried. But you know what? This is about a common enemy. And the media and the politicians need to step aside or do their job properly, because we need to come together as an American people and talk about who our enemy really is. And that is this virus. We can't do that if we're being divided and pulled apart and focused on things that have nothing to do with this. And the real problem is people don't understand what this really is. So I'm going to tell you from my perspective. my parents live in my basement apartment, and they are over 70. So I'm concerned about them, and I don't want to have them going out into the public. They need to be able to stay home and be protected. So I'm going out and getting their groceries and getting everything that they need to make sure that they're okay. And we've even isolated them in the basement, so we don't even get to interact with them. I have my grandbaby, 2-year-old little beautiful girl, who I can't see, even though she lives 5 minutes away. Because I want to protect her, and I want to protect my parents, and I want to make sure that this doesn't spread. So we're going out as little as possible so that we are safe as long as possible and get through this in as short a time as possible. Then there's my son, who works at a restaurant, and the only 3 people working at his restaurant are my son and a server and the kitchen cook, because nobody's there. And he's worried about, is he going to get paid? We have money in 401ks. My husband is working from home. My other son, his whole entire business is elderly people. He works for a senior citizens center. My family, like families everywhere, are being affected by this. Our kids are home. We're working from home. We can't find things we want on the store shelves. We're afraid to go out to the store. And then we're frustrated because we're losing money. We can't get to work. I am dealing with all of these issues in our family. And I'm pretty sure I have coronavirus. I'm here in my home, and I've been basically living in my bedroom for the last several days, because I want to make sure that I'm not infecting my family. But those days that I was out doing those things, I had no idea that I was infected. No idea. And I'm going to all these different places and interacting with people. Sure, I'm washing my hands. I got my hand sanitizer. They were really nice to have the wipes when you go into the stores. You can wipe off the handlebars or wipe off the bar of the grocery cart. But this is an airborne thing. I mean, you cough, you sneeze, and it's everywhere. It is way more contagious than the flu, and it is way more serious than the flu. And that's what people don't understand. If we want to be able to go back to school, back to work, get our money back and get the economy lifted back up, get back to some sense of normalcy, we're the ones who can do it. So here's the real issue. It isn't so much about people getting sick, because most people who get this virus are going to go through it and be just fine. It's about the medical infrastructure that has been radically savaged over the last several decades. And let's just call it what it is. Obamacare has really hit the medical industry really hard. Less people are going into the medical industry and more people are getting out. And hospitals, rural hospitals all over the country are closing. Well, where do those people go? They go to the bigger cities. And so they're overrun. We have a medical infrastructure that is not able to handle this type of situation. At any given time, our hospitals are anywhere from 80 to 85% capacity without something like this happening. So let me tell you from my own personal experience. When I started to show symptoms, immediately, obviously, I locked myself in my room. And everybody's hearing me cough, and I'm running the fever, and all these things are going on. And they're saying, you need to go get tested. You need to go. I'm like, it doesn't matter. It doesn't make nobody's going to test me. Because it doesn't matter that I have diabetes. It doesn't matter that I have probably been exposed. It doesn't matter that I was in Washington, D.C. and New York City when the big red circle was starting to explode before we really knew what was going on. None of those things matter. Because the fact of the matter is, they don't have enough testing kits. If you don't have enough testing kits, you can't test people. You've got to triage who you're testing. That means that there are way more people in the country and across the world who have this than we even know. Because the only way we can know for sure is if you've been tested. But I did my due diligence. I'm like, fine, everybody's bugging me. Do you need to call the doctor? Fine. So I went through the steps. I called our local hospital and I asked them, what is the protocol for getting tested for COVID. They sent me to a website to answer 3 questions. I answered 2 out of 3 positive. I do not know for sure if I've been in contact with someone who has been identified for sure as having COVID, because they can't test everybody. And so, but I was in Washington, D.C. I am at high risk. Anyway, through two of the 3 questions I answered yes to. So they said, we feel that you should be seen by a doctor and be tested. Call this number. So I call the number, and a clinician answers the phone and says, okay, we need you to call this number. Like, okay, so I call that number. And then they ask me a series of questions, in-depth questions. And then they said, okay, well, you're not showing any symptoms right now. So let us know if anything gets worse. And thanks for calling. I'm like, okay. So I told everybody, all right, I did what you asked me to do. I called, I did my thing, and nothing. And then a couple days ago, the cough got really, really bad, and I was having really hard time breathing. And my husband's like, "You need to call the base because we're retired military." So fine, I call the base, and they ask me the same 3 questions, and I give them the answers. And then they're like, "Okay, well, we're going to pass this on to the doctor team, and we'll get back to you." And so they get back to me the next day and ask me more questions. And they said, okay, well, can we set up an appointment with you for tomorrow on the phone? And I'm like, sure. So this started on my birthday, March 19th, and I've been dealing with it since then. And my point isn't to say, oh, poor pity me. My point is, we have no idea how many people have this. And what we do know is it rapidly spreads. Our medical infrastructure cannot handle it, and they are doing the best that they can. I can't get tested, and I'm pretty sure I have it. And you may be healthy and think you're fine. I thought I was fine when I came home on March 14th. And on March 19th, I started to show signs. So for 5 days, I was going out into the public, interacting with who knows how many people. Here's the bottom line. We're the ones who can eradicate this. And the only way we can do it is by self-isolation. And that doesn't mean that we stay disconnected. It doesn't mean that we pit ourselves against each other. It means that we need to physical distance right now, not socially distance ourselves. We need to be socially connected during this time more than ever. We need to be working together and supporting each other to figure out how to best navigate through this. And that's why we created our COVID-19 support center on the Moms for America website, because we know you're schooling from home. So you know what? We have moms who've been doing that for years. Here's all kinds of resources and help for you. We know you're working from home. Here's some ideas and tips to help you navigate it in a more productive way. Preparedness. What kind of things should you be buying and keeping at home? We have created this section of our website for you so that we can unite together. We need to come together as a people, and we need to fight the common enemy, which is this virus. So the media needs to do their job and do it right. The politicians need to just go home and isolate themselves because we're better off without them. And the statesmen, please, thoughtfully consider the decisions that you're making and where you're going to put the money that you're asking for, because that money is coming from us. Make the best decisions that you possibly can to help our medical infrastructure, to help people who truly are struggling because they can't work, and it's not because they don't want to. Can we, as a nation, as moms, come together and just pray for God's guidance, support, and loving hand over our country and the people affected by this across the world? Together we can get through this. But this is a major wake-up call. Now we know what can happen. We know the results of things like this happening. This is a time to prepare. It's a time to unite together. Because, folks, this isn't the big one. This is the test run. And how we navigate through this will determine how well we succeed when the big one does hit. whatever that big one might be. So God bless you. God bless your homes and your families. And stay home and enjoy your family. And if we all do that, then we'll be able to get rid of this whole mess, defeat the virus, and go back to living our lives, going to work, and hopefully being stronger for the experience.